Hello and welcome to Pregnancy Info. Today we will discuss the benefits of folic acid during pregnancy. Folic acid is a pregnancy superhero. Taking a prenatal vitamin with the recommended 400 micrograms of folic acid before and during pregnancy can help prevent birth defects of your baby's brains and spinal cord. Take it every day and go ahead and have a bowl of fortified cereal too. But what is folic acid? Folic acid is a man-made form of a vitamin B called folate. Folate plays an important role in the production of red blood cells and helps your baby's neural tube development into their brain and spinal cord. The best food sources of folic acids are fortified cereals. The folate is found naturally in dark green vegetables and citrus fruits. Now question is that when should I start taking folic acid? Birth defects occur between the first 3 to 4 weeks of pregnancy, so it's important to have folate in your system during those early stages when your baby's brain and spinal cords are developing. If you talk to your doctor when you were trying to conceive, they probably told you to take starting a prenatal vitamin with folic acid. One study showed that women who took folic acid for at least a year before getting pregnant cut their chances of delivering early by 50% or more. How much folic acid should I take? I recommend dose for all pregnant women is 400 mcg of folic acid each day. If you take a multivitamin every day, check to see if it has the recommended amount. If for some reason you don't take a multivitamin, you can take folic acid supplements. Here how much folic acid is recommended each day in term of pregnancy. While you are trying to conceive, 400 mcg. For the first 3 months of pregnancy, 400 mcg. For months 4 to 9 of pregnancy, 600 mcg. While breastfeeding, 500 mcg. But what are the benefits of folic acid? Without enough folic acid in your body, your baby's neural tube may not close correctly and they could develop health problems called neural tube defect. These include spina bifida, with an incomplete development of the spinal cord or the vertebra. Anencephaly, incomplete development of major parts of the brain. Babies with anencephaly usually don't live long, and those with spina bifida may be permanently disabled. These are scary problems to say the least. But the good news is that getting enough folic acid may protect your baby from neural tube defects by at least 50%. When taken before and during pregnancy, folic acid may also protect your baby against cleft lip and palate, premature birth, low birth weight, miscarriage, poor growth in the womb. Folic acid has been suggested to reduce your risk of pregnancy complications, heart disease, stroke, and some types of cancers. Here are some food that are good in folic acid that will help you in pregnancy. 400 mcg breakfast cereals fortified with 100% of the DV, 3/4 cup. 215 mcg beef liver cooked, braised, 3 ounces. 179 mcg lentils mature seeds cooked, boiled, half cup. 115 mcg spinach frozen cooked, boiled, half cup. 110 mcg egg noodles enriched cooked, half cup. 100 mcg breakfast cereals fortified with 25% of the DV, 3/4 cup. 90 mcg great northern beans boiled, 1/2 cup. High dose folic acid. If you have a high chance of your pregnancy being affected by neural tube defects, you will be advised to take a high dose of folic acid. Mean 5 mg. You will be advised to take each day until you are 12 weeks pregnant. You may have a higher chance of the problems. You or your baby's biological father have a neural tube defect. You or baby's biological father have a family history of neural tube defect. You have had a previous pregnancy affected by a neural tube defect. You have diabetes. You take anti-epilepsy medicine. You take antiretroviral medicine for HIV. They can prescribe a high dose of folic acid. A GP or midwife may also recommend additional screening tests during your pregnancy. So this is all about folic acid. That is very much important. Must share this knowledge with your friends and family members and have a happy and healthy pregnancy. Take care. Bye-bye.